Hello friends, welcome to our YouTube channel SLP Sanjay Kumar, voice therapist. And I am Sanjay Kumar. By profession, I am speech language pathologist and audiologist. And with us today live is Mr. Anesh. And Anesh is having a high pitched voice. And today we'll talk about his problem and some voice problem, why it occurs, and what we do in the voice therapy and how the voice therapy can help. So be connected with us for awareness. This live is, and keep asking question. We'll try to give the answer. So, Anish, first you tell what problem exactly you are facing. Introduce yourself.
So, good evening. I'm Anesh. I'm from Chennai. So, I've been facing this high-pitched voice from the last 5 to 6 years. So, I've been facing a lot of embarrassment and annoying kind of situations because of this kind of voice. So, I have come to know about Sanjay Kumar sir through his various YouTube channels, which gave a lot of awareness to me. So based on that and based on the different kinds of videos and different inputs that has been given by various people, I have also enrolled myself with Sanjay Kumar sir.
Okay, tell your hobbies.
My hobbies are listening to music, and I'm also interested in world affairs and news, and playing games and reading a lot of books.
Okay. So because of this problem, what are the challenges you have faced in your day-to-day life?
So especially when a person from Flipkart or Amazon calls me, and without knowing or by mistake, they think that it is a feminine kind of voice and they address me as ma'am, and that has in fact given me a lot of embarrassment at times. So apart from that, it has also lowered my confidence to a level, to a level. So these are the problems that I've been facing. So even to unknown people, if I talk or if I make a call through customer care or something, so they misunderstand that it is a feminine kind of voice. So they misinterpret. So I have faced these kind of problems.
Okay, thanks for contacting us, and we'll do the needful. And I will just try to explain why the some voice problem occurs. So before understanding the why the voice problem occurs, let's first understand how the normal speech production mechanism. And those who have joined our live session, please be connected. And this live will be near about up to 5 p.m. And near about 4:50 p.m. I will start giving a question answer session. So before that, it will be an informative session. So let's first listen, and then let's concentrate on the question answer. So for normal speech production, first thing is the thoughts that comes in the brain. Then we take air, and that air goes to the lungs, and when we breathe out, we put air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds will generate. Then we modify that sound into different sound with the help of our lips, tongue, jaw, teeth, palate. These are known as articulators. For example, if you want to say p, both the lips are coming closer together and touching each other. P, you can see. When you want to say t, tongue is coming between the teeth. When you want to say k, back of the tongue is getting elevated and touching the soft palate. So each and every sound has own place, own manner of articulation. When we say a one sentence, there are so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cords move, sound generate, we then modify that sound into different sound, one after another, because in one sentence there are so many words. In each word there are so many sound. Each sound has own place, own manner of articulation. So it's quite complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, fluency goes. So that happened in the case of a stammering or a stuttering. Of course, you are not having a stammering, just for awareness I'm telling. So if there will be lagging in the coordination among the speech production muscles with the brain, there will be non-fluent speech, and it will be reflected in the form of stammering. You may have seen that some people will be saying kiran ram, they will prolong, they will repeat, they will have the pause. And if the place of articulation and manner of articulation is wrong, suppose for the production, tongue should come between the teeth. the. And if you are putting your tongue somewhere else, the the sound will not be coming clearly. So you may have seen some patients having, some people having the pronunciation problem. They will be saying cat. Instead of cat, they'll be saying tat. Instead of saying ram, they'll be saying lam. Instead of saying kabutar, they will saying tabutar. So they will be having the something wrong, the place of articulation and manner of articulation. Let's come to your problem. Means people like yours, those who are having the high pitch kind of voice or feminine kind of voice. So this high pitch voice can be occur in so many situations, and I'll be coming at one point where the vocal cords are normal also. So first, like there may be vocal cord mass length will be not be sufficient. We call it a condition sulcus vocalis. If nature has not given sufficient mass of the vocal cord, length of the vocal cords, so then also the pitch will be higher. There may be some hormonal issues sometime. If testosterone hormone is not sufficient, in that cases also it has been seen some problem in the pitch issues. There are people, they will be having the history of vocal abuse, or self-treatment or treatment by the healthcare quacks, doing some vocal exercise by self or under the guidance of some jhola chap doctor. So in that cases also we have seen some high pitch issues and all, or something wrong in the voice. So there are situations when the vocal cords are normal, okay, but still some children will be having a high pitched voice. So why it happens? It happens because from childhood to puberty, the child will be speaking in a high pitched voice, because there will be no much difference between the boy's voice and the girl voice, because their vocal cord will be almost same. But during puberty, what happens? Due to a hormone called testosterone, mass of the vocal cord, length of the vocal cord increases in case of boys. So the vocal cord was earlier like a thin string of a guitar, but after puberty or during puberty, it becomes thick string of a guitar. It's just trying to understand, like a guitar kind of a string. So if the guitar string is thin, the pitch will be higher. If guitar string is thick, the pitch will be lower.
Low.
Okay, so child will be speaking from birth, or we can say that from childhood to till puberty, in a high pitch voice. Okay, so child will be speaking in a high pitch voice from childhood to puberty, but during puberty mass got changed and the length got changed. Okay, and because of that, the pitch should be, what happened?
Because of that, the
pitch should
pitch
be
should
lower,
be
because
lower.
mass has been increased and the length has been increased. But because of so many years habit, they will not accept the change which has happened during the puberty. So they will be having normal mass, they will be having normal length, but still they will be using their high pitch voice because of their so many years habit. So if this is the vocal cord, suppose, so they will be only vibrating thin edges of the vocal cord. So if you are vibrating thin edges of the vocal cord, then pitch will be higher. Because if guitar string is thin, then the voice will be high pitched. So what I will do as a voice therapist, I will try to stimulate the whole mass and the whole length of the vocal cord with a certain vocal exercise. Once whole mass will be stimulated, whole length will be stimulated, the pitch will reduce. So in the voice therapy, what I will try to do, I will try to stimulate whole mass and the whole length of the vocal cord with a certain vocal exercise. Sometimes I get a question like how long it will take to treat the pitch issues. So most common in my clinic is near about 8 to 10 days is the very common, but I have seen less time also, and I have seen more time also. Less time, I can say I have treated in 1 day also some patient, and some patient I have treated in 3 days also, and some patient I have treated more than 1 week also. So the person to person, sometime it varies. Health science is not exactly like a mathematics, 2 plus 2 is equal to 4. Therapy results depend upon the how your body is responding on the therapy. How good, of course, I am a therapist, so I'm giving the therapy to you, and how well you are listening my instruction and following my instruction. So there are so many factors that is also important, and how the nature has given you the vocal cord, that is also important. So I don't replace the larynx, I don't replace the vocal cord. What nature has given to you, I just try to train to vibrate in a more effective way. And once you start vibrating in a more effective way, pitch changes and it reduces and the voice improves. Okay, so at our
Yes,
center,
ma'am.
sometimes people think that we just provide the voice therapy for the high pitch voice or feminine kind of voice. But just for information, I want to say I'm a speech language pathologist and audiologist. So I provide speech therapy for the people having the communication problem, like a stammering or a stuttering, or the people having the hoarse and the breathy voice due to the vocal cord paralysis. The people are having some voice problem, like suddenly voice has gone completely due to some psychological reason, functional aphonia. We provide voice therapy for that also. And those who are watching this, they can explore us more at our YouTube channel's playlist. You can find in our playlist the communication disorder, like voice problem due to the phonatory gap, pre and post therapy video. People can find some videos before and after treatment, like sulcus vocalis cases where we have given voice therapy and what changes it was. They can see that. And even the complete loss of voice was there, functional aphonia. So in that cases, we have given voice therapy and what changes was there. People can see that. Even after stammering speech therapy, pre and post video, people can watch at our YouTube channel playlist. After the stroke, the problem happened, we call it the aphasia, the language disorder. So that video is also available at our playlist at the YouTube channel, before and after. Pronunciation problem also you can find out and you can see before and after treatment. So you'll get an idea how a certified speech language pathologist can help to the people having the communication disorder. So, and even I have seen that some patient will be coming to our clinic and they have tried self-treatment or they have taken treatment from the healthcare quacks. Sometimes they will offer very less fees, and also because of that reason, sometimes people go there. And I have seen sometime vocal nodule, phonatory gap, muscle tension, dysphonia. So whenever you are planning to take speech therapy, voice therapy, you should always take the help of professionals who are certified speech language pathologists. So now the question is that how will be you will be knowing that person is a certified speech language pathologist or a speech therapist? Because in the social media, sometimes healthcare quacks will also put with their name like a speech therapist or a speech language pathologist or SLP. So just by the words, you should not get like impressed like he may be a speech therapist. Uh, so to differentiate between the healthcare quacks and the speech language pathologist, try to find out the speech therapist where he has studied, what is the name of the college, where the college was affiliated, which university, and in which year he got the degree in the speech language pathology, bachelor or master, if he has registered in the Rehabilitation Council of India or not. And if you have a doubt, you can ask the registration number in Rehabilitation Council of India. So those will be fake speech therapists or jhola chap doctor, means jhola chap speech therapists. They will not able to provide the complete information. So in that way, you can filter out this may be the professional or this may be the healthcare quacks. So your vocal cord and voice is very, very important. Of course, we have two vocal cords, but if one get damaged also, then also your voice will be affected too much and then your life. So try to give the respect to the vocal cords and voice, and always take the help of the professional if you have a communication problem. And yeah, so Anish, you tell
Yes,
about
sir.
your problem. Then maybe people can hear your voice also before treatment. And I'll be suggesting those who are watching this live, please subscribe our YouTube channel and don't forget to watch Anish's post therapy video also. So Anish, tell about your problem again. Describe your
Yes,
problem
sir.
and challenges.
I have been facing this high pitched or feminine kind of voice for the last 5 to 6 years. And because of that, I have been facing a lot of challenges also in my day to day life. So, some of them are so usually, whenever I make an order through any kind of online app or something, so when delivery agents come to my home, so they misinterpret that a feminine person or a lady is talking on the call. So because of that, I faced lot of challenges, and apart from that, I've also lost a lot of confidence on myself whenever I'm speaking or addressing so many people in any dais or in any other public gathering. So yes, and sometimes it also feels a little bit annoying when to also speak in front of our friends also. So yeah, these are the challenges that I've been facing.
Okay. And which place you stay?
I stay in Chennai.
Okay. And you work or you study?
I study.
Okay. So what you are studying?
I am a CA student. So
Mm-hmm.
I've written my CA final examination.
Mm-hmm.
So I've also done my articleship. So yeah.
Okay. So what's your career plan?
Yeah. So mostly I am thinking about employment in any of the MNC companies out there. So
Mm-hmm.
just hope for the best.
Okay, great. Tell about your
Yeah.
family. Yes.
So we are a family of six. So father, mother, my sister, my grandparents are with us.
Mm-hmm.
So yeah, so all of us stay together, and these days it's little rare to see joint families. So people are not with their parents. So I request everybody to take care of their parents wherever they are. If it
Okay,
is not possible to be physically with them, at least try to do the needful to them, because it's the least that we can do for the kind of sacrifices that they have done for us.
Okay, thank you so much for being live. And I will just try to, you know Hindi or you don't know Hindi?
I can understand.
Okay,
I
because
can
in my
speak
YouTube
little.
channel,
I can
yeah.
try.
So at my YouTube channel, there may be people who will be understanding Hindi, or there may be some people who will be understanding English. So a little bit I'll be talking in Hindi also. Okay. So मैं ये बताना चाहूँगा जो लोग भी ये लाइव देख रहे हैं कि अनीश की आवाज़ पतली है, और पतली आवाज़ की ट्रीटमेंट के लिए उन्होंने हमसे कांटेक्ट किया। फेमिनाइन वॉइस कर सकते हैं, चाइल्डिश वॉइस कर सकते हैं। और आज हम लोग ट्रीटमेंट से पहले लाइव हुए हैं, और आप लोग हमारे यूट्यूब चैनल को सब्सक्राइब कर लीजिए, और इनका पोस्ट थेरेपी जो है वीडियो भी आप लोग देखिए, पोस्ट थेरेपी लाइव भी देखना ना भूलिए। और हम लाइव होते रहते हैं इसलिए कि अवेयरनेस क्रिएट करने के लिए सोसाइटी में कम्युनिकेशन डिसऑर्डर के बारे में और इसके अवेलेबल ट्रीटमेंट के बारे में, क्योंकि कई बार मेरे पास पेशेंट आते हैं और वो बताते हैं कि उन्हें पता ही नहीं था कि ये प्रॉब्लम का सॉल्यूशन संभव है, और इसकी वजह से उन्होंने काफ़ी कुछ लाइफ में चैलेंजेस झेला, और जॉब में, अपनी पर्सनल लाइफ में, और काश शायद उन्हें मैं पहले मिला रहा था। तो इस तरह की लाइव से मैं अवेयरनेस क्रिएट कर रहा हूँ, और मैं चाहूँगा जो लोग भी इस लाइव को देख रहे हैं, प्लीज़ आप लोग इसको शेयर कीजिए, और हमारे जो वीडियोस हैं उसको लाइक कीजिए और शेयर कीजिए, ताकि लोगों को पता चले। प्री और पोस्ट ट्रीटमेंट भी हमारा बहुत सारा वीडियो मिलेगा, अगर आपको अच्छा लगता है तो आप लोग लाइक भी कर सकते हैं, शेयर भी कर सकते हैं, ताकि सोसाइटी में एक अवेयरनेस क्रिएट हो। और बहुत सारे पेशेंट जो है डायरेक्टली सर्जरी कराने के लिए भी चले जाते हैं, और कई बार हमारे पास पेशेंट आते हैं, इनफैक्ट सर्जरी के बाद भी वॉइस थेरेपी लेनी ही पड़ती है। तो जब मेरे पास वॉइस थेरेपी के लिए सर्जरी के बाद के पेशेंट आते हैं, तो पूछता हूँ कि आप लोगों ने वॉइस थेरेपी ट्राई पहले क्यों नहीं किया, तो बताते हैं कि हमें पता ही नहीं था कि जो है वॉइस थेरेपी भी कुछ एग्जिस्ट करता है। तो जो वॉइस की प्रॉब्लम है, जैसे पतली आवाज़ है, इसका मेरा मानना है कि पहले वॉइस थेरेपी ट्राई करना चाहिए। अगर वॉइस थेरेपी काम नहीं करता है तब इनफैक्ट सर्जरी के बारे में सोचना चाहिए। और ऐसे केसेस जो कि सर्जरी के लिए जाते हैं, उनके केस में भी वॉइस थेरेपी लेना ही पड़ता है, तो क्यों ना पहले वॉइस थेरेपी ट्राई की जाए। और ऑफ कोर्स जब भी आप वॉइस थेरेपी लीजिए तो एक प्रोफेशनल से लीजिए, एक झोला छाप हेल्थ केयर पैक से नहीं लीजिए, क्योंकि प्रॉपर असेसमेंट इवोल्यूशन होना बहुत ही ज़रूरी है। दिखने में पतली आवाज़ लगती है, लेकिन इसके पीछे का साइंस जो है थोड़ा सा कॉम्प्लेक्स है, और कई सारे प्रॉब्लम्स से जुड़े हो सकते हैं, या वो प्रॉब्लम ना भी हो। जैसे कि अगर नेचर ने वोकल कॉर्ड के मास लेंथ को सफिशिएंट नहीं दिया है, सल्कस वोकलिस हम लोग बोलते हैं, तो वैसी केसेस में पतली आवाज़ रह जाती है। फोनेटरी गैप जो होता है, वोकल कॉर्ड दोनों आपस में सफिशिएंटली पास नहीं आते हैं, उसकी वजह से भी होता है कई बार पतली आवाज़। कई बार हमने देखा है मसल टेंशन डिस्फोनिया, जो कि वोकल एब्यूज़ की वजह से कई बार डेवलप हो जाता है, तो उसके केसेस में भी पतली आवाज़ रह जाती है। कई बार सब कुछ नॉर्मल है, वोकल कॉर्ड्स भी नॉर्मल है, सब कुछ नॉर्मल है, उसके बावजूद भी पतली आवाज़ है, तो दिखने में आपको एक सामान्य सा लगेगा कि पतली आवाज़ है। और हम लोग जो असेसमेंट करते हैं वो 3 माध्यम से करते हैं। सारे कम्युनिकेशन डिसऑर्डर में तीनों माध्यम की ज़रूरत नहीं पड़ती है, लेकिन बहुत सारे केसेस में हम 3 माध्यम अपनाते हैं। एक तो ये होगा कि परसेप्चुअल एवोल्यूशन, हम लोग सुन के समझते हैं प्रॉब्लम को। दूसरा हुआ एकॉस्टिक एनालिसिस, और तीसरा हुआ लैरिंगोस्कोपी, जो हमारे अदर कलीग्स हैं ईएनटी डॉक्टर, उनके पास हम लोग लैरिंगोस्कोपी के लिए भेजते हैं, ताकि वोकल कॉर्ड के स्ट्रक्चर और फंक्शन के बारे में हमें जानकारी मिल सके। और ऑफ कोर्स सारे कम्युनिकेशन डिसऑर्डर में हम लैरिंगोस्कोपी के लिए नहीं भेजते हैं। पहले हम लोग परसेप्चुअल एवोल्यूशन फ़ोन पे सुन के करते हैं, फिर उसके बाद ही हम लोग लैरिंगोस्कोपी के लिए सजेस्ट करते हैं। तो सबसे पहले अगर किन्हीं को भी कम्युनिकेशन प्रॉब्लम है तो हमें कॉल कीजिए 080-420-41980 पे। हम आपकी आवाज़ को सुनेंगे, समझेंगे, फिर ज़रूरत पड़ेगा तो कुछ टेस्ट के लिए रिकमेंड करेंगे और उसके बाद हम लोग अकॉर्डिंगली गाइड कर पाएंगे। और कई बार हमारे पास क्वेश्चन आते हैं कि सर मुझे ये प्रॉब्लम है, ABCD कुछ भी हॉर्स है, ये है, और कितना टाइम लगेगा ये। तो पहले हम लोग प्रॉब्लम को समझेंगे, सुनेंगे, उसके बाद ही गाइड कर पाएंगे। इमीडिएटली हम लोग रिस्पॉन्ड नहीं कर सकते हैं कितना टाइम या कितना कॉस्ट लगेगा। तो अब हम लोग क्वेश्चंस पे आ जाते हैं। कई सारे क्वेश्चंस आ रहे हैं। विपिन कुमार जी का क्वेश्चन है कि हाय सर, आई वांट स्पीक इन हाई पिच वॉइस, आई एम ए ट्रांस गर्ल। सो विपिन जी, आप हमें कॉल कीजिए 080-420-41980 पे। यू कैन कॉल अस एट 080-420-41980 if you are from India. If you are from outside India, you can call us at 9180-420-41980. We will do the perceptual evaluation and then accordingly we'll guide you. And if it will be needed, we'll suggest some test called laryngoscopy. So after the test, we can guide you better. And you can find our details at our website www.speechtherapyindia.in. You can click reach me and you will find many like you can find way to communicate with us, like our contact number, our email ID, and the physical address of our center on the Google map. So any of the method you can apply, you can reach to our clinic by physically, you can mail us or you can call us. So again I will repeat, मैं रिपीट करूंगा कि हमारे वेबसाइट को क्लिक कीजिए। वेबसाइट का नाम है www.speechtherapyindia.in। वहाँ पे क्लिक कीजिए रीच मी और आपको 3 माध्यम मिलेंगे हमसे कांटेक्ट करने का। फ़ोन नंबर मिलेगा, ईमेल आईडी मिलेगा और फिजिकल एड्रेस मिलेगा गूगल मैप पे। तो आप तीनों में से किसी भी चीज़ का सहारा ले सकते हैं। और थैंक यू एवरीवन फॉर ज्वाइनिंग अस। मुझे लगता है कि we can stop here, or if I'm getting any question, I will try to give the answer. Yeah, I can see all the comments. So thank you Vipin for joining us. Thank you Surekha for joining us. And thank you Moinuddin Basa for joining us. Harshal, thank you so much for joining us. So I'll try to give the answer. There are some questions also. And सुरेखा नायक लिखते हैं, सर प्लीज़ हेल्प मी, माई वोकल कॉर्ड पैरालिसिस, आई वॉन्ट ऑफलाइन ट्रीटमेंट। यस सुरेखा नायक, यू कैन सेंड योर laryngoscopy report and as well as you can call us at our call center number 080-420-41980. Our team will guide you and they will help you to fix the appointment. Or yeah, Bipin, you can call us. Thank you. And there is one more question. I am suffering from sulcus vocalis grade 1. How helpful voice therapy can in my case? See, we have not seen impressive result, to be very frank, Harshal, in case of sulcus vocalis, because nature has not given sufficient mass and the length. So I can't give you the new mass and new length with the vocal exercise. So what I can do, I can work on the tension. Like if any string vibrate, the frequency depend upon the mass of the vibrating string, length of the vibrating string, and tension. So in the acoustic, if anyone is from the science background, there was one formula, we call it say n is equal to 1 by 2l under root t by m. I will repeat that formula. N is equal to 1 by 2l under root t by m. So frequency is directly proportional to the tension, but inversely proportional to the mass and the length. And those patients who are having the sulcus vocalis, nature has not given the sufficient mass and the sufficient length. So if mass and length has not been given by the nature, I can't replace your vocal cord or larynx. So the improvement will be very, very less. But what I can do in case of sulcus vocalis, I can teach the patient to talk in more relaxed way, and I can work on reducing the tension in the vocal cord. So there can be slight change in the sulcus vocalis, and you can explore our YouTube channel's playlist. We have uploaded some videos of sulcus vocalis patient before and after, and that will give you some ideas. So hope, I think there was one question related to the sulcus vocalist. Harshal, I think you got the answer. And Vipin, I think, yeah, thank you. You also got answer. You can call us. And little bit I'll explain the Vipin situation also. Vipin says like she is in case of transgender voice, they want you want to she want to increase the pitch. So like in case of the like a high pitch voice, feminine voice, where the vocal cords are normal, so in that case vocal cord mass sufficient will be normal, but it will not vibrate effectively, and they will be using patient will be using the only thin edges of the vocal cord. So what I do, I just try to stimulate whole mass and the whole length of the vocal cord. So the nature has given sufficient mass and the length, and we stimulate. And those who want the high pitch voice, but nature has given the more mass and the more length, suppose in case of transgender, so it's practically not possible by the vocal exercise to reduce the mass and the length of the vocal cord. Is it not? Because transgender whose voice is masculine, it means what? The nature has given more mass and the more length of the vocal cord, and the that transgender want to have the high pitch voice, so that we should reduce the mass and the length of the vocal cord. So the practically by the voice therapy we can't reduce the mass and the length too much, but here also slight work can be done. How? Because the frequency depend upon the tension also. The formula n is equal to 1 by 12 under root t by m. The frequency is directly proportional to the tension. So if I can teach to the transgender patient to talk to in a way that they should increase little bit tension in the vocal cord, then we can increase the pitch. But the change will be not be magical in case of transgender. So I think Vipin, you also got some more explanation. Uh, and yes, so for any more information, feel free to call us at 08042041980. तो जो लोग डिफरेंट कंट्री में हैं उनका हम लोग वॉइस थेरेपी देते हैं, बट कुछ लिमिटेड कम्युनिकेशन डिसऑर्डर के, सारे कम्युनिकेशन डिसऑर्डर का संभव नहीं हो सकता है. तो यू कैन कॉल अस, विल डू द परसेप्चुअल एवोल्यूशन एंड देन अकॉर्डिंगली विल गाइड यू. सो yes, Sanskar Gupta लिखते हैं, I am also having some pitch and the loudness issues. So Sanskar ji, you can call us at 08042041980. And Insen, you can also call it 918042041980. We'll do the perceptual evolution, then accordingly we'll guide you. And Basa is asking, I suggest you take first voice test before, I don't know. You are suggesting to me or you are suggesting to yourself? I don't know. It is confusing. I'm removing your comments. First, you can call us, Basa, to us 08042041980, or you can call us at 918042041980, and we'll guide you in a better way. So wherever you live, India or in outside India, first you can call us. We'll do perceptual evaluation, and then accordingly we'll guide you. Yeah, so whatever our team is suggesting, you follow that. Okay, so if any based on I have trained my team sufficiently and they are enough smart to guide you, so what they are telling you, just follow that instruction. So in this live, you have any other question, you can ask us. So our online treatment is given to the people, those who are not in Bangalore. So of course, online treatment is not available for all kind of communication disorder. So wherever you are, first call us at 08042041980 if you are from India, and if you are from outside India, you can call us at 918042041980. After the perceptual evaluation, we'll guide you. Yes, Vipin, you can call us. Let's see that. I will try to help you, but first let's do the perceptual evaluation. Of course, I am the therapist at my center, so those who want my services, I'll be giving the services, but my team will be communicating with you and guiding you, because alone I can't manage everything, so we have the team. Yes, Vipin, you can call us after the perceptual evaluation. Will be guide you. Thank you, Harshal, so much. Thank you for appreciating our work. I will suggest to you, I think you are more interested in me, so you can explore my playlist at our YouTube channel, SLP Sanjay Kumar, Voice Therapist. And let me introduce myself to you also. My name is Sanjay Kumar. By profession, I am speech language pathologist and audiologist. And I have studied from AIIMS Delhi, All India Institute of Medical Science, New Delhi. And I did my graduation in the speech and hearing science from there. And I did my post graduation in the field of speech language pathology from the University of Mysore. So, Harshal, thank you so much. So, this is my small introduction for you and for others also, those who are watching this live. And yeah, so my suggestion is whenever you want to take speech therapy, always take help from the professionals. And to become a speech language pathologist in India, at least minimum 4-year bachelor degree you should have, and 2 years master to become a very good speech therapist. So 6-year study is required, not by seeing in someone's clinic what therapist is doing, and tomorrow you can experiment somebody. And if your neighbor is benefited, you make a YouTube channel, Facebook page, and write speech therapist. So if you see how the pilot is doing, or some video in the YouTube, or what engineer is doing in the YouTube, you can't be an engineer, you can't be a pilot, you can't be a CA just to writing the name. Your name is Anesh, so somebody is writing CA Anesh. Of course, if you are qualified writing CA Anesh, it's fine. But if you have not studied, you have not done finished your CA, and you are writing something CA, so it's look like a very cheap kind of thing. So this thing is happening in my profession in the healthcare field. So hope the people will understand. And there are some jhola cha people, they will give some churan also. This you take the herbs and that one in some communication disorder. Many patients come and tell us. So always you should meet to the right professional for the right health problem. Suppose if you are having the problem in the teeth, so you'll be going to the dentist. If you are having a problem in the like bone, and also you'll be going to the orthopedician. The same way, if you have a problem in the communication, so you should meet to the communication disorder specialist, speech language pathologist. And of course, sometime the team management requires, so they can guide you, they can help you to meet to the which will be the next team member of the healthcare management. And yeah, so thank you everybody for joining us. It was really interesting, and my plan was for 30 minutes, and now I think it's more than 30 minutes. But I loved your all the questions. I loved you all for joining. And thank you, Harshal. Thank you, Sanskar. Thank you, Vipin. Thank you, Dinesh. Thank you, Basha. Thank you, Insen. Thank you. Thank you, everyone. Thank you so much. Thank you. And thank you, Anish, for joining us in the live session.
Thank you, sir. Thank you, sir.
So 1 or 2 lines you can speak. At least people should listen your voice. What exactly the problem was? Just in 1 or 2 sentences, finish.
Actually, I was having a high-pitched voice. So, based on a lot of research, and I've gone through so many Sanjay Kumar sir's videos on YouTube, and based on those awareness, only I have registered myself with the team, and the team also helped me really well, and I started with the treatment.
Yeah, today is the assessment day. So after therapy again will become live. Thank you, everyone. Thank you so much.